Hi, my name is Andrea Leonard. I'm a 33-year cancer survivor and president and founder of the Cancer Exercise Training Institute. You know, for most people, when they are diagnosed with cancer, from that very moment you hear the word, your life is forever changed. Immediately you have questions about what surgery to have, what treatment to undergo, if you need reconstruction of any sort. Then you have who's going to take care of my family, am I going to be able to work, who's going to pay the bills, how am I going to take care of my insurance bills, and so on and so forth. To the point where you lose sight over the fundamentals of just taking care of yourself and proper nutrition and exercise, both of which have been shown to have a huge impact not only during treatment but also on survivorship. So I want to talk a little bit about the benefits of exercise. You know, during cancer treatment, exercise can give a patient who's struggling with severe fatigue much needed energy. Also, it can help a patient sleep better, have better appetite, move their bowels more regularly, because we need to keep that going for many reasons, but one of which is that the potential carcinogens being in contact with the mucosal lining of the stomach, we want to minimize that and keep things moving fluidly. During recovery, cancer patients may have limited range of motion from surgery or radiation. They can have muscle imbalances from an amputation or reconstructive procedure, and then of course they are still fraught with the fatigue from the cancer treatment. Some of the long-term side effects from some cancer treatments are osteoporosis, diabetes, and damage to the heart and lungs, which can all be prevented or minimized with exercise. And then also lymphedema, which is the swelling of that part of the body where there has been lymph node removal or radiation. So knowing all this and knowing the benefits that exercise can have, why is every cancer patient not given a prescription or a recommendation to exercise? Well, unfortunately, there's the medical system, and then there's the fitness or the survival, and there's not really much of a bridge. And that is what I've been trying to create through the Cancer Exercise Training Institute, by educating health and fitness professionals to work safely and effectively with cancer patients, hence bridging that gap and helping people to get back to their former level of strength and fitness, or in many cases even better. Because you have a lot of people that were sedentary, that were overweight, that had terrible nutrition habits. Perhaps that even led to them getting cancer. And now we can educate them and teach them what to do safely and effectively. And those are the two key words. So let's talk, I'm just going to focus on one specific area today, and that is going to be lymphatic drainage. When the lymph nodes have been removed or irradiated, wherever that is in the body, so upper body, lower body, that part of the body is going to be at risk for lymphedema, and that is going to be swelling. If caught early, it is potentially reversible, but if it goes untreated, it can progress to later stages and even result in elephantiasis and severe swelling. Of course, there is pain and discomfort, and then for many there is shame that goes along with it, because it can be very disfiguring. So if this is preventable through exercise, I go back to, why is everyone not told to exercise? So I am here to tell you, exercise. We have to begin with lymphatic drainage exercises at the beginning of an exercise program. So following a short cardiovascular warm-up, we begin with pelvic tilts and crunches on the floor, or if somebody cannot get to the floor, they could even do it in an upright position. It's not desirable, but it's better than nothing. And then if it's the upper body, we have a pattern that we go through, starting with shoulder retraction and chest presses, shoulder circles in each direction, and then elevating the arms up over the head, doing fist circles and fist clenches to help to distribute that lymphatic fluid and kind of push it back towards the torso, which we have hopefully eliminated some of that pooling by doing the crunches and the pelvic tilts. Now, the opposite is true for lower extremity lymphedema. in terms of the drainage pattern. We're still going to start with the crunches and pelvic tilts, but then we'll have our client, or yourself if you happen to be the patient, elevate your legs. You're going to start by bending and straightening at the knee. Then you will bend and straighten at the foot, which is called plantar and dorsiflexion. And then finish off with foot circles in each direction. From that point, you/they are ready to begin an exercise program that is going to address the specific needs. And that would begin with range of motion, because if we don't have full range of motion, the last thing we want to do is add resistance or a weight, because you will limit your range of motion continuously. So first we begin with stretches and specific range of motion exercises, and once that range of motion is achieved, then we go on to strength training exercises, because we do need to build that bone density. Many cancer patients will be at risk for osteoporosis, and then we're going to focus on areas of need. So if somebody is rounded forward, we focus on exercises that will open up the chest, like a chest fly or a row, which at the same time is going to strengthen the opposing muscles. And there we have that reciprocal inhibition. When one set of muscles is stretched, the other set is contracting. And so we have to make sure that there is a balance between both the front and back of the body as well as the sides to maintain that equilibrium and homeostasis. Now I'm giving you a very generic protocol here, and that is why we have an extensive training for fitness professionals to become cancer exercise specialists. So I will continue to make videos, but if you want a more personalized program, you can go to our website at thecancerspecialist.com, click on the patient tab, and go to the Cancer Exercise Specialist directory. If you want to call and have us refer someone to you, our number is 503-502-6776, and we are on the West Coast, open from 9 to 5. So I hope this is helpful and a little bit inspiring, that you know that there is a light at the end of the tunnel, and we at the Cancer Exercise Training Institute are here to help.